Hello, my name is Arthur Grimes. I'm a general surgery resident at the University of Oklahoma. Today I'll be discussing our study titled Intervention for Mid-Adolescents with Blunt Splenic Injury Varies by Trauma Center Type. We have no disclosures. Pediatric Trauma Society guidelines for blunt splenic injury recommend aggressive non-operative management based on guidelines from studies such as the Atomic Consortium. This differs from operative and angiography recommendations in adult guidelines. These guidelines include patients who are in mid-adolescence who are underrepresented at pediatric trauma centers studies and frequently treated at adult and combination centers. The aim of our study was to examine the adolescent population of trauma patients with blunt splenic injury to establish similarities and differences in management when compared to younger pediatric patients. To do this, we completed a retrospective analysis using 2017 Trauma Quality Improvement Project data. It included patients who were 6 to 17 years old who had blunt splenic injury and treated at adult, combination, and pediatric level 1 and level 2 trauma centers. We excluded those who died in the emergency department. Our primary outcome was spleen-specific intervention to include surgery or embolization. This multivariable model shows that between the two age groups, they had similar organ injury severities, as well as final injury severity scores. Of note, those that were 6 to 12 years old received more blood products. The study included 867 pediatric patients and 1,605 adolescent patients. Overall, adolescents underwent intervention 12% of the time versus 5.8% of the time for pediatric patients. When looking at the trauma center types, adolescent patients underwent intervention 17% of the time at combination and adult trauma centers and 7.6% of the time at pediatric trauma centers. Those in the 6 to 12 age group underwent intervention 6.9% of the time at combination and adult trauma centers and 5.3% of the time at pediatric trauma centers. Using pediatric trauma centers as a reference point, odds of intervention were higher at adult trauma centers in both age groups and only significantly higher at combination trauma centers in the adolescent age group. In conclusion, mid-adolescent patients with blunt splenic injury are more likely to undergo interventions at combination and adult trauma centers despite similarities in severity of injuries. The evidence presented here suggests that Pediatric Trauma Society guidelines are not being uniformly applied throughout trauma centers. Thank you to the Pediatric Trauma Society for the opportunity to present.